And the Lagos State Deputy Governor, Quadri Hamzat, has asked health practitioners to embrace a future anchored on sustainable, inclusive, and resilient HIV interventions in order to tackle the disease effectively. Please take a look.
Key stakeholders in the national and state HIV response ecosystem, including the Lagos State Deputy Governor, Quadri Hamzat, converge on Landmark Event Center, Victoria Island, Lagos, for the 7th National Council on AIDS to deliberate on policy reform that will provide better HIV response in the country. The Director General of the National Agency for the Control of AIDS, Dr. Temitope Ilori, shares some of the steps taken at the federal level in implementing prevention and support services for HIV and AIDS patients.
We believe that the resolutions of the Council will go a great length in strengthening the national response to HIV and, by extension, the health systems in Nigeria. The National Council on AIDS is a statutory body that is established by law to serve as the policy-making and coordinating platform for the national HIV response. The annual meeting is a testament to our commitment to a structured governance, accountability, and multi-sectoral collaboration at all levels. It is at these meetings that we harmonize our thoughts, that we integrate lessons learned, and we assess progress made so far in order to forge resolutions that will intensify our approaches to the national response. Our ultimate goal is to ensure that no one is left behind in this journey and that we work towards an AIDS-free generation going forward.
In Lagos, the Commissioner for Health, Professor Akin Abayomi, confirms that the state government has taken a strategic move to lower the cost of care and secure medicine supply.
As a country and as a state, we need to now take more ownership of HIV. We need to be responsible for managing the profile of HIV/AIDS in our respective environments. That means we need to make the cost of managing HIV cheaper, more accessible, and in a more integrated fashion. We also know that HIV runs along with tuberculosis. So if we're not managing HIV properly, its cousin tuberculosis jumps on the bandwagon. And so there's always an issue around the syndemic of HIV and tuberculosis. And both of them are security threats to us in Lagos and to us in Nigeria. Now what are we doing in Lagos? We're very serious about domesticating the National Health Insurance Authority law that was passed in 2022 by the President Muhammadu Buhari, which states that we need to make sure that all Nigerians are carrying at least a social health insurance. Lagos has been very quick to domesticate this with an executive order in 2024, and we're in the process of developing the operational guidelines to be able to roll out the mandatory nature of at least social health insurance in Lagos, and at the same time, build in components of the management of HIV such that it moves away from a budgetary allocation to one of pooled funding from insurance health financing mechanisms. We also need to focus on manufacture. We need to make sure that we're manufacturing both the consumables that are necessary for diagnosing and managing HIV, but also the drugs. And so Lagos State is developing a very advanced strategy at the Free Trade Zone in Lekki to attract the manufacture of all kinds of pharmaceuticals, but we're focusing on HIV amongst others to make sure that we have at least a domestic capacity and repository for manufacturing cheaper drugs in Lagos.
The chairman of the House Committee on HIV/AIDS also disclosed that $200 million has been approved for the fight against AIDS, tuberculosis, and malaria.
The ban on the fight against HIV response in Nigeria and all African countries is the issue of funding. An estimated $8 billion is needed annually to sustain the fight against HIV/AIDS in our country. Therefore, we in the Parliament will continue to advocate that the Nigerian government must take the lead in the fight against AIDS by increasing funding to the sector. And on our own part, we must commit to approving increased budgetary allocation to the sector and the provision of legislative interventions that promote comprehensive health care, support research, and ensure access to quality treatment and strengthen partnerships that are crucial to our collective success. The recent change in the global funding landscape as a result of the suspension of AIDS by the US government seems to have been a blessing in disguise. For me, I think it's a blessing. Because without this, even the little money we struggled to get, about $200 million, I don't think we would have gotten that. So we appreciate Trump for that shift.
And the Lagos State Deputy Governor urges delegates to embrace a future anchored on sustainable, inclusive and resilient HIV interventions.
This year's theme, advancing the national HIV sustainability agenda in the changing global policy on AIDS, I'm sure we all agree could not have come at a more crucial moment. As global donor support gradually wanes, our collective responsibility has become even more pressing. We must take full ownership of our national HIV response and build a sustainable, resilient system that can outlast policy shift and funding cycles. So over the past 3 days, my understanding is that this council has proven itself a platform of substance and purpose. We have interrogated policies, reviewed technical memoranda, shared innovations, and recommitted ourselves to people-centered, evidence-based, and right-driven responses. I'm also told that the conversations have been very frank, solution-oriented, and focused on leaving no one behind. That is what is expected of this council. It is therefore important to emphasize that the National Council on AIDS, as empowered by NACA Act of 2006, should not just be another meeting. It is the highest coordinating platform for shaping the direction of HIV/AIDS policy and programs across our country. The resolution adopted during this council must therefore, I'm sure, reflect collective wisdom, experience, and aspiration of our nation in fighting this menace. But they must not remain on paper. They must find lines in our budget of various states, in our policies, our legislative actions, and above all, in the lives of our people.
The three-day conference is a wake-up call for stakeholders in the health sector to collectively ensure effective management and control of HIV in Lagos and Nigeria at large.